In a shocking turn of events, thousands of patients insured by UnitedHealthcare (UHC) will no longer have access to in-network care at Johns Hopkins Medicine (JHM) facilities. This comes after 8 months of unsuccessful negotiations between the two entities, with the core issue being how medical care is approved and reimbursed. But here's where it gets controversial. JHM claims that UHC's practices put insurance company profits ahead of patient health and well-being. Imagine being one of the nearly 60,000 people in D.C., Maryland, and Virginia who are affected by this split. If you're one of them, you'll now have to pay out of pocket if you want to continue seeing your trusted JHM providers. And this is the part most people miss. This applies to employer-sponsored plans, individual and family plans, Medicare Advantage plans, and Medicaid plans. But what if you're undergoing active or ongoing treatments for a serious or complex condition? Don't worry, there's hope. You may be eligible for continuity of care coverage, which allows you to continue receiving care from your current provider at in-network rates until your treatment concludes. This includes pregnant women, people fighting cancer, and those who've already scheduled transplants or are currently undergoing transplant treatment as of August 25th. Now, here's where things get a bit murky. UHC says it's repeatedly compromised with Johns Hopkins during negotiations. However, they couldn't agree on contract terms that would have allowed JHM to refuse certain patients at its discretion and required UHC to pay for claims submitted in error. But is this just a smokescreen to hide the real issue? UHC also claims that Johns Hopkins' allegations about how the insurance company handles its claims are misleading and inaccurate. They report approving and paying 90% of claims shortly after submission, while the remaining 10% undergo an additional review process. Once this process is complete, UHC's approval rate sits at an impressive 98%. So, who's telling the truth? Despite the ongoing dispute, both institutions have vowed to continue negotiations. In the meantime, patients must navigate continuity of care options or find alternate providers. If you're a UHC member affected by this split, visit https://www.uhc.com for more information. What do you think about this situation? Do you believe JHM is truly looking out for patients' best interests, or are they just trying to strong-arm UHC into agreeing to their terms? Let us know your thoughts in the comments below.